Trump administration executes mass layoffs at health agencies, raising alarm. In a sweeping move that has sent shockwaves through the public health sector, the Trump administration has begun implementing mass layoffs at key federal health agencies, including the Centers for Disease Control and Prevention and the Food and Drug Administration. The termination, part of a broader initiative to cut 10,000 government health jobs, have raised critical concerns about the nation's ability to effectively regulate drugs, respond to health crises, and oversee critical medical research. Sources familiar with the situation confirm that the dismissal have impacted multiple agencies under the umbrella of the Department of Health and Human Services, including the National Institutes of Health and the Substance Abuse and Mental Health Services Administration. The cuts come as a part of President Donald Trump's aggressive effort, backed by billionaire entrepreneur Elon Musk, to significantly downsize federal agencies deemed as a bloated bureaucracy. The layoffs of the National Center of Immunization and Respiratory Diseases, that is NCIRD, for instance, included personnel involved in the federal response to measles outbreak, raising concerns about the government's ability to contain vaccine-preventable diseases. Meanwhile, at the NIH campus in Bethesda, Maryland, employees faced morning traffic jams as they arrived to discover they had been laid off, highlighting the disruptive nature of the sudden termination. The mass fringes were carried out with brutal efficiencies. At FDA headquarters, employees were required to present their ID badges upon arrival. Those whose names were flagged were handed a dismissal ticket and ordered to leave the premises immediately. The ticket seen by Reuters included contact number for 10 different departments to coordinate the retrieval for their essential equipment. Elsewhere, terminations were delivered via email, coldly assuring employees that their dismissals were not a reflection of their service performance or conduct. The sweeping nature of these layoffs raises critical questions about the future of U.S. public health infrastructure. While the administration insists that trimming the workforce will eliminate inefficiencies, skeptics fear it could destabilize regulatory agencies that are essential to ensuring drug safety, managing epidemics, and funding critical medical research. The timing of the layoff is also significant, occurring against the backdrop of a renewed global focus on pandemic preparedness and emerging health threats. With the Trump administration's past clashes with public health institutions, including its contentious handling of the COVID-19 pandemic, the latest move is being widely interpreted as a further attempt to weaken the influence of federal regulatory agencies. As federal employees pack up their offices and the health sector braces for their triple effects, one question remains: is this a strategic restructuring or a systematic dismantling of public health oversight in America?